2010, the United States government spent over $15 billion on the war on drugs. Simultaneously, illicit drug use for Americans aged 12 years and older increased from 8.7% in 2009 to 8.9% in 2010, totaling about 22.6 million people. The war on drugs was created under the Nixon administration to stop illegal drug use in the United States. However, drug use has slowly increased since the beginning of the initiative. Clearly, our current system is not effective in its goal to end drug use. Much of the blame falls on the current laws and regulations surrounding drug use, as well as the institutions designed for drug users. Instead of punishing those who use and are addicted to drugs, we should consider a system that is set up to help them overcome their dependencies, and change the laws surrounding use of non-addictive and non-harmful drugs. The first issue to consider is how we react to drug use. In the United States, our policy is punishment for breaking federal laws. At a federal level, the law states that any person using or possessing an illegal drug, including marijuana, is a criminal. It is important to mention that 15 states, including New Jersey starting on January 1, 2021, have legalized marijuana use for adults 21 and over. Drug offenders will be arrested, charged, and in many cases imprisoned for their drug use. Our current system sees drug use as a criminal issue instead of a public health issue. The United States has the highest overdose and drug incarceration rate in the world, and by a lot. Drug offenders are also the group with the highest repeat offense rate, which makes sense when you consider that many of these people are physically or psychologically addicted to their drug. As we can see from the data, our drug initiative did not work as intended, and continues to punish people who cannot help themselves overcome addiction and dependency. Let's take a look at a country that chose a different route when confronted with a drug epidemic. In the 1990s, drug use, especially heroin, was rampant all over Portugal. Portugal had some of the highest per capita overdose and HIV infection rates in Europe. The infection rate coming from shared or reused injection needles. In 2001, the Portuguese government decided to take a radical position. They decriminalized all drugs in the country. The money they had been spending to fight drug trade and arrest drug users was instead transferred to the building of rehabilitation centers. Police officers were instructed to approach drug users calmly and offer them a pamphlet for their closest rehab center. This plan has worked tremendously in all arenas. Overdose rates, new HIV cases, and incarceration rates all dropped off steadily with these laws in place. Slowly, drug use decreased across the nation as addicts were able to wean themselves off in facilities that offered high-quality drugs, clean needles, a safe place to use, therapy, social workers to help them find jobs, and a community of people trying to put their lives back together. Portugal's drug policy has been recognized as the most humane approach to drug use, treating addicts not as criminals, but as sick patients needing support. Now that we've looked at countries with drug policies on two different ends of the spectrum, we can compare the results of both. The United States war on drugs has caused a huge increase in drug incarceration, repeat offenders, and overdose rates by failing to provide services to users in need. Portugal's statistics on the same factors have all decreased significantly and created a system of compassion and support. Continuing our flawed system will only lead to more unnecessary deaths, imprisonment, and billions of dollars of wasted funds. It's time to consider our options for ending the war on drugs and progressing our policies to more effectively help those in need. The two options we have are decriminalizing drugs and legalizing drugs. With decriminalization, personal use or possession would be considered a summary offense, the lowest possible offense given. Offenders would either be given a fine depending on where they were using, or left alone entirely. Legalization would create a system in which users could buy cleaner and safer versions of their drugs and not have to worry about dealing with police or the legal system. Both systems would greatly benefit the drug incarceration rates, especially if they are coupled with laws to lessen sentences or release those who were charged with only possession or use. Another important initiative to add to these programs is the building of rehabilitation facilities across the country, offered at no charge to the user. When considering decriminalization versus legalization, most countries or states have done it on a case-by-case study. Marijuana, with low levels of personal harm and no physical addiction, is a good candidate for legalization. Other drugs that fall under this category are hallucinogens, such as LSD or psilocybin mushrooms, both proven to be effective treatments for psychological issues such as post-traumatic stress disorder. Some drugs have high levels of personal harm and are extremely addictive, such as heroin and other opioids. These drugs might be considered too dangerous for personal use, and decriminalization would be a better path for them. However we choose to implement it, drug reform would save thousands of lives, billions in funds, and would allow drug users who need the most amount of help to finally receive it.